Vitamin KN presents how socioeconomic status affects physical activity levels. Based on the U.S. Census Bureau's 2017 estimates, the overall poverty rate is 12.3%. An estimated 39.7 million Americans lived in poverty just last year. A study by the American Diabetes Association found that those living in low-income neighborhoods had a higher risk for obesity and diabetes. The 5 socioeconomic barriers presented in this video are self-efficacy, food and nutrition, environmental barriers, lack of time, and physical health. Self-efficacy is defined as being one's ability to achieve his or her goals. The Journal of Behavioral Medicine states the importance of how self-efficacy can be for one's confidence and self-esteem. The focus on the role of self-efficacy on exercise and/or rehabilitation are becoming more and more apparent, and is discussed to be a main component to if an individual will participate in exercise. A positive correlation is seen between self-efficacy and physical activity. It has been found that individuals with a low socioeconomic status and less education tend to have a lesser self-efficacy level, ultimately affecting their overall physical activity. As discussed in class and other kinesiology courses taught at UIC, health coaches can be utilized to promote an increase in self-efficacy and self-esteem to achieve a particular task.
Diet and nutrition is an SES barrier because it does affect your ability to participate in physical activity because research done by Ovrum, the Research Council of Norway, they were interested in seeing how severe the disparities were between higher and lower socioeconomic populations based on what they're eating. And actually what they found is Ovrum even stated that the socioeconomic gradients in important lifestyles may be steeper and thus more severe than previously assumed. This means that they found that higher economic status populations were eating much more better quality foods such as fruits and vegetable quality meats, and the lower economic status had a very, very much more lower access and less access to quality meats, quality vegetables, quality fruits. And this affects their participation in physical activity because they might have confidence issues to go out and participate in physical activity. Also, based on what you eat, it determines how much energy you have, how fit you are, whether you're even able to go on a jog or play any sports. So it does affect, it is a pretty significant SES barrier.
Another socioeconomic factor that affects participation in physical activity are environmental factors. Research has shown that there is a correlation between environmental factors and physical activity. In Australia, many individuals in peri-urban areas live sedentary lives and have poorer health conditions than those living in other cities. The barriers contributing to this lifestyle are lack of infrastructure, sidewalk and road conditions, and transportation to recreational parks. Lack of physical activity is also influenced by safety and street violence. Improving neighborhood recreational areas by providing more parks, walking trails, and facilities will encourage individuals to partake in physical activity. Overall, improving environmental factors can help reduce poor health conditions and cardiovascular diseases such as obesity, diabetes, and hypertension.
One of the most common barriers for physical activity that people face is lack of time. Whether it is regarded as a legit reason or a convenient excuse is up for debate. A study by Dr. Stephanie Vaughn about the participation of Hispanic women in physical activity found that the multiple roles they play in their daily life, such as wife, mother, worker, and housekeeper, made the women feel that their time was already stretched too thin, leaving them with little to no personal time for exercise. However, in a study about the perception of time by minority women done by Drs. Hesh and Mass, concluded that the perceived lack of time by the women did not translate into reality. Although it must be noted that unlike this study, Dr. Vaughn had participants of lower SES. There are various ways to get through the lack of time barrier. It has been shown that adherence to a workout schedule is stronger when physical activity programs are more social and are offered near home or the workplace. Exercise professionals should also be sensitive to their client's personal schedule. If a patient can't do 30 minutes of walking every day, breaking up the schedule in sections peppered across the day is always an option.
So, physical health. I think it's important to define what physical health is before we go into the topic. Physical health, also termed as physical wellness, which is defined as, according to the University of California, Davis campus, the promotion of proper care of our bodies for optimum health and functioning. Why is it important? It motivates us to nurture our body in three main ways: physical activity, proper nutrition, and mental toughness. So physical activity, evidence has shown some pros are strengthened bones and muscles, reduced risk of stroke and disease, and an increase in energy. And for nutrition, what goes into your body is just as important as getting your body moving. So that's making the decision between a McDonald's versus going to Whole Foods. And then for mental health, the pros are sharpened cognitive skills and improved esteem and locus of control.
In conclusion, it is important to lower the disparity between higher and lower socioeconomic statuses by encouraging individuals in lower SES to exercise. Research has shown that exercise can help lower stress, anxiety, and depression. In a longitudinal study, adults who were overweight as children living in low SES conditions showed higher work stress than those who were not overweight. A pilot study conducted with a low SES population showed that yoga helped reduce anxiety symptoms. In Korea, another study showed that children living in low SES had a strong association with depression, and their quality of life was improved by exercising. Overall, the following should be implemented to lower the disparity between higher and lower SES populations: health coaching, making school lunches healthier, improving infrastructure, and encouraging health insurances to cover gym memberships.